What is Accutane? Isotretinoin. Isotretinoin is a form of vitamin A that is used to treat severe nodular acne that has not responded to other treatments, including antibiotics. How should I take isotretinoin? Follow all directions on your prescription label and read all medication guides or instruction sheets. Use the medicine exactly as directed. Always take isotretinoin with a full glass of water. Do not chew or suck on the capsule. Swallow it whole. Follow all directions about taking isotretinoin with or without food. Use the medicine for the full prescribed length of time. Your acne may seem to get worse at first, but shall then begin to improve. Dosing. The dose of this medicine will be different for different patients. Follow your doctor's orders or the directions on the label. The following information includes only the average doses of this medicine. If your dose is different, do not change it unless your doctor tells you to do so. The amount of medicine that you take depends on the strength of the medicine. Also, the number of doses you take each day, the time allowed between doses, and the length of time you take the medicine it depends on the medical problems for which you are using the medicine. For oral dosage form, capsules. For acne, adults and children 12 years of age and older. Dose is based on body weight and must be determined by your doctor. The dose is usually 1/2 to 1 mg per kilogram of body weight per day, taken as two divided doses for 15 to 20 weeks. Your doctor may adjust your doses needed. Children younger than 12 years of age, use and dose must be determined by your doctor. Contraindications. Pregnancy. Allergic reactions. Accutane, isotretinoin, is contraindicated in patients who are hypersensitivity to this medication or to any of its components. Accutane should not be given to patients who are sensitive to parabens, which are used as preservative in the gelatin capsule. Special instructions. Isotretinoin is just a single dose can cause severe birth defects or death of a baby. Never use this medicine if you are pregnant or able to become pregnant. You must have a negative pregnancy test before taking isotretinoin. You will also be required to use two forms of birth control to prevent pregnancy while taking this medicine. Stop using isotretinoin and call your doctor at once if you think you might be pregnant. What are the possible side effects of isotretinoin? Get emergency medical help if you have signs of an allergic reaction. Hives, difficult breathing, swelling in your face or throat, or a severe skin reaction, fever, sore throat, burning eyes, skin pain, red or purple skin rash, with blistering and peeling. Storage. Store the medicine in a closed container at room temperature, away from heat, moisture and direct light. Keep from freezing. Keep out of reach of children.